Republican senator from New Hampshire and ranking member of the Budget Committee, Senator Judd Gregg, and the Republican representative from Arizona that writes Joe Wilson's material. We, of course, speak of member of the Energy and Commerce Committee.
You lie.
I lie. I know I lie. He's a friend.
Lie.
I can do it. John Shadegg. Sorry about that, John.
He's been taking these cheap shots at me his entire life.
I'll protect
and look what it's got me, okay? It works.
It's got you a good job.
It works. So keep working at it, son.
You'll get there one day.
You want me to punch him?
No, yeah, here. This is for you, John. Ow, God. All right, Senator Gregg, let's start with you. You're ranking member on the Budget Committee. The president tells us he's not going to sign a bill that's not deficit neutral. How does he get there from here?
Well, I don't see it. There's some natural laws that govern us. Water runs downhill. Another one is when you add $1 trillion. When you add $1 trillion of new spending to the federal government, or maybe even $2 trillion of new spending to the federal government, you usually don't end up paying for it. And if you do pay for it, it slows the economy through massive taxes, or you're ending up cutting Medicare and moving that money over to another program. So I just don't see it happening. I think this is a very serious situation. We've got a massive debt piling up on this country, and the bill that's before us today, at least the Senate bill that's before us today from the Kennedy-Dodd Committee, that added over $2 trillion over a 10-year period to the deficit or to the debt and to the size of the government, and that's not tolerable.
John Shadegg, it sounds when they start talking about efficiencies in Medicare, it sounds eerily reminiscent of what we talked about in 1995 when Democrats said that we wanted to yank Granny out of hospital rooms and throw her into the street. It seems to me like Democrats are going to go there, that they are going to try to, I guess, reduce the size of the increases in some Medicare programs to pay for this. Claire McCaskill talked about it earlier. You think that's where they're going?
I really don't think that's where they're going, Joe. I think that's just rhetoric. I think that in point of fact, they have real cuts to Medicare Advantage, but beyond that, they're going to pay for this with increased taxes and increased debt.
John, will you explain really quickly, because Claire talked about Medicare Advantage. Claire McCaskill, explain really quickly what that is to Americans.
It's an option that people have to buy their Medicare program through a private provider rather than through the government and to get additional options. Democrats have hated it since the get-go. They think it costs too much money. I think it could be improved, but I don't think it should be taken away. The Americans that are on it love it. But the president initially planned to cut $500 million out of that program just this year, or just implement this program. And then he turns around and says there are no cuts to Medicare. I think this is rhetoric. And I think one of the weakest parts of the speech was the president's credibility on what it would cost. You just can't stand in front of the American people and say, I'm going to expand coverage for all the uncovered. I'm going to give more coverage to the people who already have insurance. He says free preventative care, and announced, well, we aren't going to increase the price, but we're going to make them give you free preventative care. So he's going to create something out of nothing. But he says there's no price to that. I just don't think that's credible.
It certainly has been and is a fair question. Nora O'Donnell has a question.
Senator, I know that you are a deficit hawk and concerned about that, but what about the president's argument last night that these health care reforms will cost less and add less to the deficit? Well, he said it won't add a dime to the deficit compared to the Bush tax cuts and what we've spent in Iraq and Afghanistan.
Well, I just find it very hard and really unacceptable to say that when you're fighting a war, you've got people in the field defending your country, and that war was brought upon you in large part by an attack on our nation, that is at the same level as expanding and creating a new entitlement. Just not comparable expenditures. The first obligation of government is national defense. We have to spend what it takes to keep our troops in the field with all the equipment and all the support that they need.
And what about the Bush tax cuts?
Well, the Bush tax cuts have been debated for a long time. I happen to think they were a good idea, and if you look at it historically, they actually generated more revenue over the period than the allegation that they cost us revenue. In fact, by the time the Bush tax cuts had been fully phased in, we were getting about 19% of GDP in revenue, which is the highest level we've been in history, and the upper income people were actually paying more in taxes than they'd paid at any time, especially during the Clinton years. So I think the Bush tax cuts were a good idea, and I think you incentivize an economy by giving people an incentive to go out and create jobs and take risks, and you do that by keeping the tax burden reasonable.
And then, Congressman, can I jump in on the issue about small businesses? Because I was asking Steny Hoyer about this earlier. When it comes to small businesses, it's not yet clear to me or in any of the reporting that's been done about how they plan to mandate that small businesses cover employees. In particular, I mean, a law firm of 10 people can make more than a restaurant of like 60 people. Can you spell out specifically what you understand the Democrats are trying to do in terms of mandating what kinds of small businesses will have to cover and how much of their health care will they have to cover?
Well, they'll have to cover a minimum federal program, and I think that touches on an issue where the president failed in the speech last night. He seems to think, or at least in his remarks last night, that the only thing that makes this a government takeover of health care is the public plan. In point of fact, it is all the minutia spelled out in the bill. You have to write a plan that meets the federal government requirements as to minute details, all the way down to not just the appeals process or what's covered or what's not covered, or what you can charge or not charge, but the bill, at least the House bill, says you have to meet federal standards as to how you advertise. That's the concern that Americans have, and I don't think he addressed that. And I think the mandate itself is something that has proven it isn't working in Massachusetts. It actually has not worked in auto insurance. In the states that have mandatory auto insurance, there are more uninsured motorists than in the states that don't have mandatory auto insurance.
Well, I think the problem here that wasn't pointed out was he changed his rhetoric on the issue of whether you're going to get to keep your health care. He said, you won't be required to change your health care, but the problem is the way this thing is structured, they're going to say to a company, well, we're going to fine you about $7,000 or $8,000 if you don't have health insurance. Well, if they have health insurance, it costs them around $14,000 to $15,000, so it's a no-brainer for the company. They pay the fine, and then you end up moving those folks off of the private sector into the public sector. So it's cheaper. And that's going to be a snowballing effect.
It's cheaper to pay the federal fine, Mike Barnicle, and then you say, okay, don't worry about it. I'm not doing health care, but my people can do this public option. Well, and so pretty soon you gut the
unless you get a tax credit, though, Senator, right?
Okay.
Excuse me?
Mike Barnicle.
Senator Gregg, let's stick with that theme. There's proposals that take these Cadillac health plans and tax them above $8,000, which would make the Cadillac health plan a Prius health plan. And I've read and I've heard that when this happens, corporations would then take the money that they're saving instead of, buying the bigger, more expensive health plan and put it back into their employees' pay raises. What do you figure the odds are of that happening?
Well, first off, I happen to think it's a good idea to not allow the high-end health plans to be deductible. I think that creates two events. First, it creates an incentive for people to be more intelligent about how they buy health care. They're not going out and over-purchasing health care. And when we're talking high-end, we're talking $17,500 and above. I've never heard $8,000 and above. But the low end is $17,500 above. The Finance Committee was talking plans that cost more than $20,000 and above. And secondly, you do generate significant revenues from that, which you can use in other places in the healthcare system to try to shore it up and make it more effective. As to whether or not the employee will receive a benefit in the sense of the company suddenly doing something better for them, I can't answer that question.
I think a lot of those high-end health plans are union health plans, which I think is going to cause a problem for the president.
The only reason this is being opposed is because the labor unions don't want it. I mean, it was actually a proposal put forward, ironically, by Republicans. I mean, here Republicans are offering to actually increase taxes by saying, we don't think these high-end health care plans are constructive to, first, the way you purchase health care, and second, to the way the tax laws work, so let's tax them. And the Democrats are rejecting it simply because the unions say no.
Proving, once again, that Washington is no meritocracy.
No.
These two guys don't deliver the Republican response last night.
What's the deal?
Seriously, it is never a meritocracy.
No,
you guys need to get on a bus and go around the country.
You didn't think that was a strong response?
John Madden's not using his bus. We'll borrow that one. You guys go.
Where were you?
Yeah.
We appreciate that.
Thanks, Joe.
All right. Thank you, Senator. I bet you're sorry you're not Treasury Secretary. John Shadegg, keep up the good work for Joe Wilson. His opponents raised $100,000 since last night.
Okay. Guys, thanks very much.
Thanks,
we appreciate it. They really make a lot of good points and raise a lot of good
questions. They really did.
Yes.
Whether you agree or not, great points.
Up next.
The Cadillac health plan, your health plan changes.
Right now at Men's Warehouse, you'll find a great selection of fall designers.